Welcome to another edition of All Things Nursing Leadership and Management session. We are going to discuss questions and answers. So I'll give you a description of the questions we're going to discuss together with an appropriate example. So I will beam the question on the screen, then you use it as your guide. If I'm too fast, you can leave it in the comment section. Then if you have any questions, you can also leave them in the comment section below. So let me give you a guideline on how the questions are. So we have number 1, define quality improvement. Then number 2, we have the 5 essential elements required for quality improvements in healthcare provision. Then we have the third question, which is discuss the 5 principles of quality assurance. Then we have the fourth question, which is discuss the 5 qualities of a good leader. Then we have the fifth and final question, which is the 5 barriers of assertiveness faced by managers. Let us begin with objective number 1 or question number 1, which is define quality improvement. So when you're looking at quality improvement, it is defined as a systematic and continuous action that leads to measurable improvements in healthcare services and leads to improvements in patients' care outcomes. Then let us discuss the second objective, which is our question 2, the 5 essential elements that is required for healthcare provision. So we have number 1, patient-centered care. So under patient-centered care, we're looking at respecting individual preferences and values. An example would be a nurse adjusts a care plan to include a patient's cultural dietary needs. Then another element is safety. So when you're looking at safety, you're looking at the ability to minimize risks and harm. So an example would be double checking medication dosage before administration. Then we have another element, which is effectiveness. So under effectiveness, you're focusing on using evidence-based practices. An example would be administering antibiotics based on the current infection control guidelines. Then we have another essential element, which is timeliness. So under timeless, you're looking at reducing delays in care. So an example would be fast-tracking lab results for critical patients. Then we have equity, which mainly focuses on providing fair care regardless of background. So here an example would be offering translation services for non-English speaking patients. So this can be foreigners per se. Then let us discuss the 5 principles of quality assurance. So the 5 principles as follows. The first one is quality improvement. So under quality improvement or continuous improvement, you're looking at an ongoing effort to enhance care. So an example would be conducting monthly audits to track infection rates and adjust protocols. Then we also have another principle, which is customer focus. So under customer focus, you're basically looking at meeting patients and stakeholder needs. So this can be achieved through conducting patient satisfaction surveys and acting on feedback. Another key principle is evidence-based practice. So when you're looking at evidence-based practice, you're looking at using the best available research. So an example would be updating ward care procedures based on new clinical studies. Then we have accountability as another principle. So when you're looking at accountability, you're looking at taking responsibility for outcomes. An example would be nurses document care accurately and report errors promptly. Then we have teamwork and collaboration. When looking at teamwork and collaboration as a principle of quality assurance, you're looking at focusing on working together to ensure quality. Then an example would be something that can be applied on the ward or something that is mainly observed. You're looking at interdisciplinary ward rounds, including nurses, doctors, and pharmacists. So they both play a role in sharing knowledge and also enhancing patients' care outcomes. Then we have the fourth question, which is the qualities of a good leader. So we have quality number 1, integrity, which is why a person upholds honesty and strong ethics. So an example would be a nurse manager admits a scheduling error and corrects it promptly. Then we have another quality of a good leader, which is communication skills. So under communication skills, you're looking at the ability of a manager or a nurse manager being able to apply clear and effective communication. So this is achieved through an example, which is leading daily hurdles or removing distractions to update staff on patient care priorities. Then we have empathy. So this is a quality that a nurse leader should have. This mainly focusing on understanding others' feelings or needs, or in short, putting yourselves in another person's shoes. So here, a nurse manager supports a nurse dealing with burnout by adjusting their workload. Then we also have decision-making ability. So this is another important quality of a good leader. So a good leader should be able to make timely and effective choices. So an example would be quickly reallocating staff during sudden patient surge. Then we have visionary thinking. So under visionary thinking, you're looking at inspiring long-term goals. So under long-term goals, an example would be launching a mentorship program to develop future nurse leaders. If I'm too fast, you let me know so that I can adjust in the next presentation. Then if there's anything that you are willing to contribute, you can leave them down in the comment section. Then let us look at the last final question, which is the 5 barriers to assertiveness faced by managers. So we have number 1, fear of conflict. So under fear of conflict, this is where a nurse leader basically avoids confrontation. An example would be a nurse manager hesitates to address poor hygiene practices to keep the peace. Then we have low self-confidence. So this is why a nurse manager doubts his own abilities or even his voice to enforce change. Then an example would be a nurse leader. This should be a nurse leader who is new at the facility, avoids giving feedback during team meetings. Then we have cultural norms. So under cultural norms, you're looking at communication styles as they vary per traditions or per culture. In most settings, women are not regarded as they have the ability to hold leadership positions. So this mainly affects them to be assertive. So an example would be, in some cultures, directness may be seen as a sign of disrespect. Then we have lack of training. So not knowing assertive techniques might also be a barrier. So here a nurse manager struggles to say no to extra tasks due to poor boundary setting skills. Then we have hierarchical pressure. So under hierarchical pressure, you're looking at feeling constricted by authority. So here a junior nurse feels intimidated to change a senior physician's unsafe order. So you're looking at a situation where a doctor a nurse is afraid to approach a doctor even though he has made an error concerning the prescription or even the care plan for a manager. So this leads to that nurse not being assertive. So this marks the end of this presentation. I hope you find this information useful. Then I urge you to participate adequately. If you have any concerns, leave them down in the comment section. From me, peace, and may you revise adequately. Thank you for your attention. See you next time.